and to extend health care coverage.
Okay. Now this, we kind of drifted into the subject of Medicare, and you are not old enough for Medicare.
Not yet.
I am. Our crew members here are. Roger Carlson is our great director. Many of our viewers are Medicare. So let's go down that road some more. And some of these questions don't have answers right now, but I'll toss them out anyways. The donut hole, whereby people on Part D are still paying premiums, but they're not getting any coverage
Right.
because they've spent, quote, too much money. Is this donut hole going to be closed?
This issue comes up, it's an annual issue that I think members of Congress and their staffs are dealing with. There are efforts in Congress to close the donut hole. We haven't seen it happen yet, but it is a big problem when you've been receiving the benefit and then you come up against a spend out threshold where suddenly you find that you don't have any coverage until you've spent considerably more out of pocket. So I think there are going to be efforts to address that down the road here.
And you're not only not getting anything, but you're still paying.
You're paying.
Yeah,
you're still having to pay the
yeah,
premium,
so.
but you're getting no benefit during the period that you're crossing from one end of the hole to the other.
So another part of Medicare Part D is the fact that Medicare is barred from negotiating price deals with the big companies.
Right.
Is that going to be changed?
You know, Dan, I was actually working out in Washington when Congress passed this, and I remember saying to many of my friends, I said, when a lot of people find out what they did here, they're going to be very upset. The general rule in government programs is price competition, but the pharmaceutical industry was successful in getting a provision in the Medicare Part D bill that basically said no competition on pharmaceuticals provided through Medicare Part D. And there are a lot of people in Congress who realize that the extreme costs that Medicare is bearing right now under Part D and providing prescription drugs is in large part because of this provision. So I think there is an effort underway in Congress to change this and to allow more competition on pharmaceutical prices. That'll be good for patients, it'll be good for seniors, it'll be good for the government in reining in some of the costs for Medicare.
We can't hold our breath, though, for right now and wait for it to happen.
I don't think it's imminent, but there continues to be a lot of talk about this.
Speaking of imminent, for people on Medicare Part D, they have an open enrollment period. And when is that?
It's from November 15th to December 31st every year when people can engage in the open enrollment for Medicare Part D, which is the prescription drug coverage portion of Medicare.
Yeah. So if you're unhappy with your Medicare Part D, here's a chance to compare companies. If you are happy, you can still check prices, and you can seek help for this through the senior linkage line or other sources. Okay. One final question in the Medicare area, or actually two. Okay. What is happening with the Medicaid program?
You know, what we're seeing in Medicaid is similar to what we're seeing across the board, that the costs are going up significantly, in large part because of the current economic recession that we're in, that a lot of people who are losing their jobs are finding that they can't make ends meet. They are now qualifying for Medicaid. Right here in Minnesota, we've seen 35,000 Minnesotans, many of them single, childless adults with physical and mental disabilities who were cut off by the governor's decision on unallotment. And so those folks now have a possibility under the health care reform bill of applying for Medicaid coverage. And interestingly, the federal government, at least for the first couple of years, would pick up 100% of the cost of enrolling those individuals in Medicaid. And then after that, the states would pick up or the federal government would pick up 90% of the cost after 2 years. So it's a real significant hit that we're seeing in Medicaid right now, but there's real significant need. And the idea of saying that, well, just leave those people on the curb and let's not give them any health care coverage, as I mentioned earlier, they are going to show up at the door of the emergency room. And the care that they're given there is going to be very expensive, and sooner or later, we all end up absorbing that cost.
Given all this, why are so many seniors reluctant to have changes in the healthcare system?
I think, Dan, that there's a great concern because of so much of the misinformation we've heard this summer, which really, I think, was deliberately calculated to scare a lot of people. We're more comfortable with what we know and maybe a little bit less comfortable with something that's new or different. But when you think back to what is the motivating drive for healthcare reform, it's a couple of things. It's to make sure that we're covering those millions of uninsured Americans and also trying to maintain the quality care that people have come to expect. There's nothing in these healthcare reform bills that are moving in Congress that takes away people's personal decisions on their healthcare choices in terms of what doctor you see, in terms of the delivery of healthcare, but there's significant changes in the legislation to rein in some of the abuses that we see in healthcare in terms of some of the practices of insurance companies, for example, in denying people coverage. So we have to remember that, and I think people really need to look very carefully at this. There aren't a lot of opportunities to enact significant legislation like this, and I worry that if we miss the boat here, we're going to continue to see these double-digit increases in healthcare costs.
How do you react to horror stories that people say that, well, in Canada, you know, people are in line and they're dying, and or other countries?
You know, it's interesting. I've been listening to the Canadian Broadcasting Corporation lately on my XM radio in my car, and there's a lot of outrage north of the border among Canadians when they listen to the American healthcare debate. And this is from Canadian healthcare professionals who say that there have been a lot of misrepresentations about their system. Do people sometimes wait? Yes, for elective procedures. Emergency procedures, there's no indication whatsoever that people up there would wait any longer than here. But you know, what's significant, I think, you can point to a lot of people in America who didn't have health insurance, who were forced into personal bankruptcy. Nobody in Canada that I know of has declared personal bankruptcy because they couldn't get health care.
Okay. Our viewers can go to a couple other websites, mnafl-cio.org or retiredamericans.org for further information. Steve, do you think that there will be a bill in 2009, one that the president will sign?
I do. I think that there's going to be a bill which is probably going to have less than many people would have liked in the bill, but also is going to have more than some people would have wanted in the bill. These are very complex issues, but I think at the end of the day, we're going to have a bill that makes some very significant reforms, especially in the area of insurance, and especially in trying to get a handle on health care costs.
Okay. Steve Francisco, the Federal Policy Director of the Minnesota Council for Nonprofits, I thank you for sharing your 20 years of experience with us. And on behalf of the Minnesota State Retiree Council, AFL-CIO, I thank you. And please come back again.
Thank you, Dan.
And our viewers, keep on watching.